Cardiovascular disease is the leading cause of death in women, and your risk can increase after menopause. That's leading to changes in the way women are treated for menopause. The founder and CEO of Ms. Medicine, Dr. Lisa Larkin, filled me in on this important information for women's health. Dr. Larkin, so good to see you. Menopause is a time for lots of changes for women, we know that. And there's a big new finding about heart disease and menopause. Tell me about that.
So this is really exciting. Since the Women's Health Initiative data was published in 2002, which is a long time ago, there has been really confusion about the risks and benefits of hormone therapy. Those of us that know the data and have been looking at this for the last 18 years have really known that younger women are different than older women when it comes to cardiovascular disease. And this is really exciting that now the American Heart Association has come out with really an endorsement of our understanding of hormone therapy, suggesting that younger women are in fact different than older women and that there are benefits of hormone therapy to treat menopausal symptoms in terms of lowering cardiovascular risk in younger women.
Yeah, so what are those links between menopause and cardiovascular disease?
Right, so there's all kinds of things that happen at menopause with the loss of ovarian hormones, specifically mostly estrogen. And that causes changes in physiology. So an increase in cholesterol, an increase in blood pressure, an increase in insulin resistance and the development of diabetes. And women will notice this immediately, but a change in where they deposit fat. So women go from this very pear-shaped body to having lots more abdominal fat. And we know that abdominal fat and increasing fat around the heart is a risk factor for cardiovascular disease. And so again, these are changes that happen and aging happens. And so the question just continues to come up, is hormone therapy to treat menopause symptoms good for cardiovascular disease or bad?
So a lot of doctors have kind of shied away from hormone therapy with women in the past, but is there a specific window of time that this helps certain women?
Right, so the criteria we really use are women who are under 60, who are less than 10 years from that final menstrual period. These are the women where they don't have established vascular disease in general. Their risk of cardiovascular disease is low. And so we have this understanding of what's called a timing hypothesis, which is that estrogen has a different effect in these younger women in terms of heart health compared to older women. And I think this is great news for women who are symptomatic at menopause and should really consider hormone therapy.
So if I talk to my doctor and say, I'm interested in this, I think it would be helpful to me, and my doctor says, no, we don't think that's a good idea, how do you communicate with your doctor, some of these new findings and what you want?
Right. This is really, really, really hard. Hard for patients and hard for doctors. We know that clinicians largely don't understand the hormone data and have great fear of prescribing hormones. So a lot of times women are really just told they're not a candidate for hormones. We really do understand that there are a group of women, these younger women who are having symptoms, who are often excellent candidates for hormone therapy because it is the most effective therapy. And if your doctor is really uncomfortable talking about hormones, doesn't really know the data, I encourage you to look for a clinician who does a lot of menopause. One of the great resources is the North American Menopause Society. You can go to www.menopause.org and find a menopause certified clinician in your area. And again, not taking anything away from your existing doctor, but this is kind of a subspecialty that not all clinicians know the data.
Dr. Lisa Larkin, thank you so much. It's menopause.org, and Ms. Medicine, Dr. Larkin's practice, is also a good resource for you. Happy holidays.
Thank you. You too.